This is the second half of a two-part video on controlling macular degeneration. Part 1 provided an overview, and Part 2 will cover treatment. Here's some background. Deficiency of vitamin A is common. It affects the skin and epithelial tissue, including the tissue lining the gut and the lungs, and the immune system. Beta-carotene and mixed carotenoids are not true vitamin A. They are converted to vitamin A only if the liver is healthy and energetic. In the diet, true vitamin A is found in large amounts only in liver. Since liver contains high copper as well as high vitamin A and zinc, and liver oil does not, the best source of vitamin A for macular degeneration appears to be natural high vitamin cod liver oil, not the type with the vitamins removed. You can eat liver to get vitamin A, but you may want to take extra zinc to offset the high copper content of the liver protein. Vitamin A dosing, safety issues. Many conventional physicians are reluctant to recommend vitamin A, both because they are unfamiliar with its full range of benefits and because they believe it to be toxic at long-term doses above 10,000 international units per day. This is why manufacturers tend to use beta-carotene or mixed carotenoids instead of true vitamin A to avoid the toxicity controversy. But these toxicity studies used synthetic vitamin A and failed to balance it with vitamin D. High doses of fat-soluble vitamins should always be balanced to avoid toxicity. Toxicities have never been found for natural vitamin A taken as cod liver oil. Natural cod liver oil containing vitamin A as retinol, retinal, and retinoic acid is also balanced by vitamin D. It has been used therapeutically in high doses by traditional cultures throughout history and has never been shown to be toxic. For more background, see the Weston A. Price Foundation. They are a major advocate for fat-soluble vitamins in the diet. Regarding synthetic retinol, such as what you might buy in a drugstore, it appears that high-dose toxicity is not a risk if the vitamin A is balanced with vitamin D in a ratio of at least 1 part vitamin D to 10 parts vitamin A. So, if you can't find high vitamin cod liver oil, take any old vitamin A as retinol, 10,000 international units per day. Consider taking more, at least for a few weeks, to restore your levels, along with some vitamin D. Incidentally, if you take vitamin D at high doses, then you'll want to make sure your calcium intake is adequate, so do look into this at some point. Zinc needs vary, since zinc is rapidly depleted by stress, and macular degeneration certainly equates with oxidative stress. So people with macular degeneration or other chronic illnesses need much more zinc than does a healthy person. So zinc dosing must be individualized. Don't use the guidelines for healthy people, say 50 milligrams a day. As a starting point for treating chronic illness with zinc, use the same number of milligrams as your weight in pounds. So if you weigh 150 pounds, try 150 milligrams of zinc per day. In the long term, you'll want to read about the other minerals and how to balance them, but don't worry about that if you're just now starting on high-dose zinc. Regarding the type of zinc, zinc chelates, like zinc gluconate or zinc picolinate or such, are better absorbed than zinc oxide. Zinc oxide can be a good source for healthy people, but not for those with chronic illness. So, the optimal dose of zinc depends on your particular diet and metabolism, but in general, many of us on healthy diets have too much copper, and almost all of us have way too little zinc. In the body, zinc competes with copper for absorption and transport. Zinc is found in seafood and animal protein. It's not prevalent in the diet, so unless you're eating the ultimate caveman diet, you're not getting much zinc. And as we've said, zinc is rapidly depleted by stress, and macular degeneration is a type of stress. So most people are low in zinc, and if you have macular degeneration, you can be sure you're very low in zinc. On the other hand, copper, though an important nutrient, is found in many foods. Thus, deficiency is unlikely except in the poorest of diets. So most people get plenty of copper, and people with liver problems often have too much copper. So how do you increase your zinc and decrease your copper? It's tricky. Many zinc-rich foods, like seafood and organ meats, contain high levels of copper. Zinc is found without high copper only in meat, poultry, and eggs. So if you have wet macular degeneration, you might want to get most of your protein from these sources. If you do eat seafood or organ meats, you'll want to take even more zinc. If your case is very aggressive, or if you're ambitious about self-help, here's a list of other micronutrients you may want to try. But if you're already eating enough fresh vegetables and are optimizing your digestion and absorption, you may not need these. Before closing, I'd like to say a word about mercury. Mercury, whether from fish, dental amalgams, food contaminants, or air pollution, gets stored in the brain. Thus, the body burden of mercury cannot be measured. Chronic mercury poisoning appears to be a hidden epidemic, contributing to many neurodegenerative diseases. This is clear in the research literature, but is not yet widely recognized among the public or even among physicians. Mercury contributes to macular degeneration in several ways. It causes oxidative damage, it disables hemoglobin, exacerbating hypoxia, that is, the need for oxygen, which can then trigger new blood vessel growth, and it causes retention of copper, and copper stimulates new blood vessel growth. So, is mercury causing your macular degeneration? You might want to read about chronic mercury poisoning. Andrew Cutler is a good source. So, to summarize, take vitamin A as some form of retinol. The best source is high vitamin cod liver oil. Regarding dosage, take 10,000 international units of any brand of vitamin A, or 25 to 30,000 international units of vitamin A as natural high vitamin cod liver oil. Take zinc in chelate form, say 50 to 150 milligrams per day. Eventually, read about copper-zinc imbalance, copper toxicity, and high copper foods to decide if this issue might apply to you. And in the long term, read about balancing of minerals including zinc, copper, manganese, and iron, or perhaps you'll correct your imbalances so quickly on vitamin A and zinc that you can cut your dose to a maintenance level and not worry about balancing high doses. And finally, look into mercury. Frequently asked questions. Can I regain any lost vision? If you have inflammation that is causing some blurring, or if the blood vessels are so new that they can be treated before the nerve cells of the retina die, then yes, you can regain some vision. But if the nerve cells have died, you cannot. For more information, here are some references appropriate for both laypersons and health professionals. Good luck!